Hello, this is Dr. David Green, CEO of the Colorado Pain Network. The topic today is avoiding surgery for degenerative disc disease. The normal intervertebral disc contains 80% water, 20% are collagens and proteins. The analogy is that of a jelly donut where you have a tougher outer covering, which is called the annulus fibrosus, and actually the annulus has nerve endings, but not the inner part, which is the inner jelly known as the nucleus pulposus. So it acts as an excellent shock absorber as we walk and jump and run. Water is forced out of the disc to absorb the shock, and then water comes back in. As we get older and degenerative disc occurs, and we'll talk about the reasons for it in a moment, but essentially what's happening is the disc is losing water content. And you can see a healthy disc here, and then as you start to lose the water, you start to get compressed, and then it can get all the way compressed. And pain may occur from the resulting tears that occur in the outer part of the disc, called the annulus. 40% of the time, a person's low back pain is coming from an intervertebral disc issue. This may cause inflammation, and it can irritate adjacent nerve roots and lead to sciatica as well as back pain. So degenerative disc disease may lead to disabling pain, or it may be completely asymptomatic. Studies show that 35% of those between the ages of 20 and 50 have degenerative disc disease, like you see here on an MRI, and no symptoms whatsoever. Just because you see it doesn't mean it's going to be painful for a person. So here are some treatment options. Medications are helpful, such as over-the-counter Tylenol and Advil. For short-term acute exacerbations, narcotics may be helpful. Topical pain relievers, whether they're prescription or over-the-counter, can be very helpful, along with muscle relaxers on a short-term basis. Physical therapy can be very helpful. That may include modalities such as ultrasound or electrical stimulation, chiropractic treatment with manipulations or additional modalities. TENS units are about the size of an iPhone. They go on your belt. They're battery powered, and they have little foam pads that go on the skin with a little electrical impulses that go through the skin and can change the way the brain perceives pain signals. Spinal decompression therapy, as you see here, involves intermittent spinal traction. It can be exceptionally helpful in over 85% of patients for pain relief and avoiding surgery. And then things such as acupuncture have been shown to be very helpful as well. There are some interventional treatments. Trigger point injections, which are sub-Q injections that can help with muscle spasms and aching. Intradiscal injections, such as you see here with steroid, have been shown in studies to provide upwards of 3 months of consistent pain relief. There are facet treatments, because if you have an abnormality in the disc, it can shift stresses back to these joints here called the facet joints. So injections into the facet joints may help with pain relief, or around facet joints, which are called medial branch blocks. There's also a procedure where the area around the joints are heated up, called radio frequency ablation. That can provide pain relief for 6 to 18 months. Very effective. If the nerve roots are being irritated around the area of the disc, an epidural injection can be helpful. There was a procedure called an intradiscal electrothermal treatment, which is IDET. And what would happen is they would heat up the disc itself, but that has fallen out of favor because it didn't work as well as hoped. Mild is minimally invasive lumbar decompression, and that involves a catheter going into the disc, pulling out some tissue to decompress it. That's had some promising results. Here's a picture of radio frequency ablation. The catheter comes into the area around the joint in the back, the facet joint, and it deadens these tiny little nerve endings here. Eventually they'll usually grow back, but it may be 6 to 24 months that you get pain relief consistently. Stem cell injections are not quite mainstream yet for degenerative disc disease, but they're getting there. Studies of stem cell injections are in place, and they are showing so far good results with either bone marrow or amniotic-derived stem cell materials. Comparison of long-term outcomes for patients with back pain and a discogram that shows one disc responsible for pain did not demonstrate a significant difference in outcome measures of pain, health status, satisfaction, or disability based on whether the patient was electing for fusion or non-operative treatment. So what this means is that non-operative treatment is typically the way to go, whereas a surgery for degenerative disc disease often turns into a roll of the dice. 3/4 of the time, patients are able to achieve a satisfactory level of baseline pain with degenerative disc disease and avoid surgery. So over 3/4 of patients are able to avoid surgery and obtain non-operative pain relief. Colorado Pain offers the top pain management centers in the metro Denver area, along with Buena Vista and South Granby areas. Over 50 insurances are accepted, and over 50 treatment options exist, offered by board-certified pain management doctors who've won the Patient's Choice Award 5 years in a row. So call today for scheduling at 720-306-9575 and visit us on the web at painmanagementdenverco.com. I'm Dr. David Green, CEO of the Colorado Pain Network. Your pain stops here.